The culture, they say, starts with the leader, the way he was raised and his background. In my case, it's a little humble barrio. Everybody was very religious, very kind to other people. That's essentially the culture that continues with this company. It's about people, helping people, and it's about, I say it's the soul of Gonzaba Medical Group.
So 2019, we've experienced growth throughout Gonzaba Medical Group. Some of the highlights are the new specialty center, a new 8,000 square foot facility that really offers true coordinated care. Guadalupe clinic re-expansion, new clinic, new location is currently underway. Started new radiology services, 3D mammography that is really cutting edge in diagnosis of breast cancer. Have recently started doing breast biopsies that significantly shortens the time from an abnormal mammogram to diagnosis and initiating treatment. We started new programs, diabetic optimization program, pain management program, and hopefully soon behavioral health program.
So the benefit of having our specialists work with us in primary care and urgent care, as well as having our own specialty building clinic at the main clinic has monumental, wonderful benefits. First off, having our specialists around allows us as primary care physicians and urgent care and our whole team, even our nurse practitioners and PAs, to work all together and directly communicate with our specialists, which further enhances the care for the patient. Further, having our own specialty clinic makes it more convenient for our patients because they have their own set place to go to when they see our specialists. They will not get mixed up with primary care or urgent care.
So Gonzaba Medical Group is able to grow at an elevated rate compared to other medical groups because of our connection with the community. We do over 60 events a month. We connect with our seniors, not just in the clinic, but of course out there in the community, all the events that we do. We have yoga classes, exercise classes, we have produce giveaways, and they really appreciate that. No other medical group is doing that.
So Gonzaba Medical Group has really positioned itself and evolved into a system that delivers value-based healthcare. Value is really defined as providing quality healthcare, better outcomes, right care, right time, care that is safer, and a much higher, better patient experience. If you focus on these factors, the secondary effect is you lower the cost of care. And we've been able to reinvest money back into developing more programs within the organization that supports a value-based healthcare system.
So when it comes to radiology services at Gonzaba Medical Group, first off, all the equipment we use is brand new, state-of-the-art equipment. For instance, our mammography analyzers are three-dimensional analyzers, and I was told that we're the only primary care clinic in Texas, perhaps the United States, that has this level of equipment. Further, we have high-resolution CAT scanners. Further, we have really top-notch MRIs to get all the images that are very important, necessary to make the right diagnosis. When it comes to the staff that runs this equipment, they are specialty trained and they're top in their field. That's the type of employees we recruit to run this type of equipment. One important thing to elaborate on is that we also have interventional radiology. And what that means is we are now able to intervene in a radiologic study in order to get better data. For the average person, that would mean, for instance, we use ultrasound or CT-guided biopsies to get the proper tissue to make the diagnosis.
The plans for 2020 involve continued growth, of course. We're going to grow at an increased rate because we've added a new contract, Humana. We're thankful to have them as a partner, and it's the second most popular plan in San Antonio, right behind United Healthcare. And it's going to be another offering for our patients, and it's going to allow us to grow at a quicker rate than before.
So the most important growth that we've seen throughout the organization is in our human resource capital. It's you, our employees. And we realize investment in the future is investing in you. So as an organization, we have committed to initiate staff development programs, develop a learning organization, leadership training programs, mentoring programs. We realize that Gonzaba Medical Group is really you. You are the face of Gonzaba Medical Group, and you are what embodies Como Familia. Now, Como Familia, we see it in our advertisings, and it means a lot of different things to a lot of different people. And it really is hard to describe what Coma Familia is. But in essence, it's the heart and the soul of the organization. It is the North Star. What guides our thoughts, our actions, our behaviors, and how we treat patients, and also how we treat each other within the organization.
So right now is a very exciting time for Gonzaba Medical Group. We've changed so much in the last 59 years, and we could not have gotten to where we are right now without you, the employees, and all of our staff and support and patients. We're looking forward to a great 2020, and we'll be celebrating our 60th anniversary as Gonzaba Medical Group.
First of all, you need to make sure that what you have today is flawless. If there's some gaps that need to be fixed, we've got to fix it to make a flawless, fundamental way the way people are being managed. Secondly, if you have the right people, for the right reason, working as a cohesive team, strong people, strong leadership, cohesive team that working together for a common goal. My responsibility is to make sure that there's a good succession plan to continue this legacy, this culture, for the purpose and the way that it is today. Bottom line, that's what culture is. It's about people's beliefs, how people behave, and how people can work with each other. Very much like a basketball team. Basketball team, people work together. They hold each other accountable, and they work together for a common goal. Right? Same here. Our people work together for a common goal and for our purpose. Our purpose is kind of like a calling, something kind of spiritual in many respects. Our purpose is about doing the right thing for our patients, treating our patients with respect and with love. And it's about people feeling that they've done something meaningful. When they come here, they feel that they've done something meaningful other than just the bottom line for GMG or for that paycheck. They're here because they feel like they're doing something very meaningful for our patients. And if you think about it, treating the sick,